The optometrist does the complete eye examination as a doctor would do, including slit lamp, IOP, fundus exam with the 90D, and where indicated, they would do a fundus photography. In all diabetic patients, they are asked to take a fundus photography, and then do a entire data is entered into the electronic medical records, where simultaneously ophthalmologist from the base hospital is looking at the data, and then they get into a teleconsultation mode. Every single patient walking into each of these vision centers get a teleconsultation with the doctor, and based on the need, whether it's glasses or medicines, are dispensed right in the vision center, so the loop is completed. It's seen only 10% of the patients ever seen in the vision center needs to be referred to the base hospital. Next slide. So this is the concept of vision center, where we have a hub and spoke model, where one of the base hospital has multiple, other tertiary hospitals have multiple vision centers attached to it. Next slide. So this is one slide. This is supposed to be the best last mile connectivity in any healthcare intervention as of today. And it has access to care for the people in those areas 6 days a week. Since it's locally available, more patients are accessing. And the most important is there's no dependence on attenders for these patients to go and visit a hospital. There's obviously time and money saved. But more importantly, we have found that compliance to care, especially for diabetes, glaucoma, these patients can be followed up much better, and it is the onus of the vision center technician to ensure the continuity of care in these vision centers. So this is next slide. So this has become like we are doing almost 2,000 consultations a day across our 91 vision centers. But more importantly, during this COVID period, we had more consultations than in the base hospitals through these vision centers. And this was really a boon for the people in the remote locations. Next slide. So this is just the numbers. We had in the last 1 year about 4.5 lakh patient visits to these vision centers in the last 1 year during this COVID period. Earlier, it was much higher. Next slide. So it has become a scalable model. Next slide. So with Tripura was the first center where we opened 40 vision centers in 2007. And in the recent times, these are getting replicated by the government of these different states. Recently, Tamil Nadu has planned to start 32 vision centers in Tamil Nadu. Next slide. And Bangladesh is another place where there are major expansion. About 400 vision centers are being established with our help. The first 90 has been started, and this is becoming a real good way of reaching the patient in the remote locations. So I'll stop here. I won't go ahead with further in the interest of time. Oh, I'm sorry. I should mention the LVPI and the model. The LVPI had started this primary. I mean, they were starting the first vision centers. And then recently they've started integrating it with the technology. And so patients are examined by vision technicians, and teleconsultation referral is based on specific guidelines which they've integrated, and using integrated medical records, they are able to advise the patients accordingly. So there are a lot of attempts that they are doing to improve the diagnosis in these vision centers. So these are the numbers. I will stop here in the interest of time. Thank you.